By morning, that block opens up and the brain flushes the system with these endorphins. What do the endorphins do? Well, number one, they raise the natural killer cells, they raise the CD4 helper cells, they raise the CD8 killer cells, the macrophages go up, the immune system starts to rise. The other thing is that these endorphins travel to the opiate receptor sites. Why you don't want to use morphine? Because the morphine is an opiate and it'll fill up the opiate receptor sites. Interestingly enough, the cancer cells also growing out of the tissue that it originated from are loaded with opiate receptor sites. So the endorphins go to the opiate receptor sites in the cancer tissue, lock in there like a lock and key, and create a condition known as apoptosis called suicide, cancer suicide. So it works in several mechanistic ways, and I would encourage everybody who's got cancer, particularly those with testicular cancer, prostate cancer, pancreatic cancer, and lymphatic and leukemia cancers. They're extremely effective for that, but it's all good and all. This is how it works. It works on all these other issues. There's 3 statistical surveys, 80 to 85% efficacy in preventing disease exacerbations, in other words, from getting worse. That was my doctor who just died a year ago, Bahari, in New York City. His experience, he's the one that developed the whole protocol for HIV patients because they have basically immune incompetence. So if you have cancer, you have immune incompetence. And so this shows you on the pie chart, you know, just how effective just LDN is. And these were people that were conventionally treated. So you look at these numbers here, it's pretty significant. So strengthening the immunity and modulators. This is the basic immune system. I'm not going to spend a lot of time, but the bottom line caption here says ratios are important. So I used an immunologist out of Tempe, Arizona to look at my blood for ratios of my immune cells. Not just my levels, the ratios of those numbers. And it tells you a lot. So here's some of my studies. It's not all of them, but you can see the ones that are in red, I'm in trouble. This is going way back to 1999. There's the ranges. And I don't have CD4 cells that are doing a job. I don't have lytic units. That's the activity or strength of the natural killer cells. I'm in trouble there. And the absolute CD8s, I'm low in. So why wouldn't an oncologist who's going to treat you with an immunosuppressive drug want to know what your immune profile looks like before they give you a drug that's going to suppress it even further? They don't ever look at this stuff. Never look at this stuff. Never look at it. So these are some immune modulators. There's lots of them out there, low-dose naltrexone, beta-1,3 glucans from the mushroom extracts. That's why they're effective. Adamar fermented wheat germ quinones. Quinones, remember that word? That's vitamin K3 and K2. All right.